today about a new innovative dimension on handling the issue of domestic violence. First of all, I want to thank the Lieutenant Governor for his steadfast and outstanding leadership on this topic of domestic violence. Often people call it a woman's issue. Well, it's not a woman's issue, it is a family issue, and we need every good man who can to stand up for us, to fight for us, and to make sure that we have the resources to deal with what's going on in our families. The Lieutenant Governor has talked about domestic violence in his own family. He's seen it in streets and neighborhoods. He's seen it as a lawyer. He's seen it everywhere, and he's not only seen the problem, he's taken action for the problem in terms of a comprehensive legislative agenda and actually putting money in the state checkbook to be able to deal with this. So, Lieutenant Governor, we want to offer you our heartfelt gratitude for your Congressman been an outstanding advocate of the trauma center here and a real leader, and he'll tell you about the house. But my friend Ben has truly been an advocate for dealing with the issues of domestic violence, going back to his House days in the Maryland General Assembly, now into the Congress, and most recently in the Senate. He took leadership in 2013 for the new authorization of violence against women. It was a new day. It's a new century. It's a new demographic. And how do we deal with this silent killer, this silent danger in our own homes? And Senator Cardin took the leadership to give us a new framework for the violence against women that enabled us to have new ways, new approaches, many of which we're going to be talking about today. So we want to thank him for his steadfast advocacy. Here at University of Maryland has always led the way in dealing with trauma. Trauma comes in many different ways. So when we think about the original trauma response here, grade, gold, the hyperbolic chamber, dealing with the golden hour, we thought of trauma as automobile accidents, big crashes on highways, awful kinds of situations. Then it was the response to individual emergencies that led the way, but also the University of Maryland, coming through that ER, sees problems that often everyone else overlooks as a real problem. And it is here at the University of Maryland, under Dr. Cooper, for the last 20 years, has really led the way in one of the most remarkable responses to domestic violence. Dr. Cooper, we want to thank you for your leadership. The fact that this University of Maryland Trauma Center here has always kept a watchful eye on who is coming into the ER. And when they say, oh, I just fell down the steps. Oh, that boiling water just accidentally fell on me. Oh, it was just an accident. They always ask the next question to get the right answer about the fact that the most dangerous place in America for many families is their own home. But doctor, we know that no matter how dedicated you and Dr. Stein and others have been, you haven't been able to act 24 hours a day. And when you asked the question, there needed to be more questions. And you needed social workers there. You needed people whose emergency placements could be made. Well, doctor, to you and to all of those who want to lend a helping hand, help and hope is on the way. The program that we're announcing today, under the leadership of the Lieutenant Governor, the state of Maryland, and the University of Maryland, really is going to offer not only a hospital-based domestic violence program, yes it is, and yes it has, but now it's going to be 24 hours a day, 7 days a week, the first in the country. We want to really, because we know that when you have to respond, and I speak now as a social worker trained here at the University of Maryland. I was a child abuse social worker, so I know about these issues up close and directly. We know that first of all, you need identification. That's where the admitting officer really talks about it. But after you do identification, you need to have intervention. And this is where you need a whole team to come in. And then you need prevention to make sure it doesn't get worse and then you need protection. This is where, when they come to University of Maryland, if you are a victim of domestic violence, you're going to find a medical home and a safe haven and a way to a new living. So we're very excited about it. We in the federal government are partners. Under the leadership many years ago of Vice President Biden, we established the Violence Against Women Act. We also established the Crime Victims Act. We had to reauthorize it, and Senator Cardin has led the way in the Senate. And then I come in and help put it in the federal ship. We were very happy to provide the funds overall in the crime victim bill. $10 billion for the nation. But this program will get $50,000 from the federal government to be the federal partner in being able to do this. We want to do more. And this is why Senator Cardin, working hand in hand in the Senate and across the room with Dutch Ruppersberger, we're going to put $500 million into the Violence Against Women bill so that we can respond, we can intervene, we can recover, and we can rehabilitate these families. So God bless you for what you do every day. You are truly not only saving lives, but you're changing lives. And we're very grateful that the University of Maryland will lead the way, and I believe the rest of the country is going to learn from you, Dr. Cooper, and the wonderful work that's going to be done here to the assistance of great technical staff here. So God bless you. Let's protect our United States of America, and let's protect our families. Thank you.